Hi everyone, it's Derek here from AdoMed. Heavy menstrual bleeding is one of the most common reasons why we refer patients to our gynaecology colleagues. As a result of this, it is really commonly encountered in exam scenarios. So let's take a look at some of the background and assessment of patients with this condition.
Heavy menstrual bleeding, by definition, is irregularly occurring menstrual bleed deemed by the woman as excessive that interferes with her physical, mental, and emotional well-being. Although there are several causes of menorrhagia, in about 50% of women, no cause is found. Such cases are labelled as dysfunctional uterine bleeding. Uterine and ovarian causes are amongst the most common causes of heavy menstrual bleeding and include fibroids, endometriosis and adenomyosis, and others. There are also systemic causes and iatrogenic causes. In this day and age, where patients often turn to natural remedies, it's interesting to note that some studies show that a few herbal remedies can alter estrogen levels, disrupt the coagulation cascade, thereby affecting menstruation. Examples of these include ginseng and soya. Now, a focused gynecological history is important in these patients. Ideally, you want to find out about contraceptive and sexual history, cervical screening, details about the menstrual cycle, the effect on the quality of life, and also if the patient has any wishes to conceive. The reason why these facets of the history are important is that they help us to form a differential diagnosis and will also affect the management. It's also important to find out if there are any associated symptoms in addition to the heavy menstrual bleeding, such as pelvic pain, intermenstrual bleeding, and a history of a pressure-like pelvic sensation. If there are associated symptoms together with a history of heavy menstrual bleeding, you should examine these patients. This will include abdominal, bimanual and speculum examination with or without swabs, depending on what you're looking for. If you've made it this far into my video and haven't yet subscribed, tap that subscribe button and turn on the bell notification so you don't miss any of my videos. Thank you so much for watching, and I'll see you soon.